An increase in mortality rates can be attributed to the lack of access to medical care. And as the Jubilee government seeks to fulfill its promise of access to affordable healthcare, KTN's Sharon Momanyi highlights a new technology that promises to offer part of the solution to this challenge.
The fundamental problem of lack of access to medical care in many parts of rural Kenya is one we have largely highlighted. Lack of health infrastructure at these levels creating a deplorable situation. But as solutions to this are sought, a technology that links patients in remote areas to health practitioners using the internet begs audience. Call it telemedicine.
In order to make efficient healthcare provision and make it accessible, we need to be able to provide distance consulting, which is what telemedicine does.
Bildad Tindi, a patient from Embu Town, was in need of a second opinion regarding her diagnosis by a doctor from Nairobi. This was made possible by the Afya telemedicine service from Daktari Health, one of the few organizations offering this medical technology. Using simple internet connection, Bildad received medical advice through a video conference.
Bildad, yeah, up to the time you are through with the drugs.
As you do a consultation through telemedicine, you can involve a second doctor and a third doctor for a second opinion. Gives you that liberty then to better, treat the patient that you have before you.
The fast-growing emerging health service makes use of known devices like blood pressure monitors. Only they are fitted with USB ports to enable the transfer of the information to a caregiver or storage in a central database.
Having a central repository of information provides that kind of help to governments. And with telemedicine, you have one more way in which you collect information on a regular basis, if you have it as a program nationally, to guide you on what is happening in terms of disease patterns and treatment and management of different situations.
For all its demonstrated possibilities, particularly in developed countries, is telemedicine a concept woven in Kenya's health service? The Cabinet Secretary for Health, James Macharia, says it is part of the ministry's plans.
It fits very well with our current concept. And basically it's anchored on about four things. First is about you need centers of excellence. And these referral hospitals like Kenyatta, Moi Referral are supposed to be, or they should be, centers of excellence. Number two, there are certain hospitals which are specialist hospitals. Like you hear Eye Hospital, Kikuyu Eye Hospital, and so forth. And then thirdly, there's a cost. The cost of healthcare is very high. So you can afford to have all the facilities in all the hospitals across the country.
The Jubilee government promised to first focus on preventive healthcare as it is less expensive. Their manifesto guarantees that every family has access to a fully equipped health center within 5 miles of their home, with a national network of local community health workers promoting preventive health services based at the centers. This new technology may be a stopgap measure, but just like any new concept, teething problems abound.
The biggest challenge is that for it to happen, you need a very robust digital platform. Because if you're talking about the 4,800 facilities in Kenya, how do they communicate with each other? Currently, they don't. You find if you go to some level 3 hospitals, for example, you enter the outpatient, you find a very big ledger.
On Saturday, the 15th of February, Dhanush Infotech Limited launched a digital medical school, with Kenya being the pilot in a one-of-a-kind project slated to be launched in other African countries later in the year. This new medical technology holds big promises to solving major healthcare service delivery problems, particularly that of access to all. The challenges notwithstanding, it remains to be seen when this will come close to you. Sharon Momanyi, KTN, Nairobi.